My name is Sam Williamson, and I'll be walking you through a short presentation focusing on hypokalemia. As we know, hypokalemia is a potentially serious condition where a cat's potassium levels fall below a normal range. This condition is often underdiagnosed, which can have serious implications, including a negative impact on renal function, and can also be associated with arrhythmias. It's actually quite surprising just how straightforward this condition can be to correct in most cases. The importance of veterinary nurses in its management is key, and we'll start to review how early detection and effective management can lead to an improvement in the cat's quality of life. So, as veterinary nurses, you are our frontline defenders. And as nurses, you have the opportunity to support early detection, often recommend treatment, and be there with ongoing client support for cats. There are 4 key culprits that may lead to hypokalemia: anorexia or impotence, whereby as a result the pet is not taking enough potassium in their diet; chronic kidney disease, leading to increased potassium loss through urine; and other medical conditions, including, as an example, vomiting or diarrhea, which can cause potassium depletion. And finally, there are some medical conditions that can be caused by medical intervention. So we now know what are some of the key culprits, but what about spotting the signs and symptoms? The 2 most common are muscle weakness and lethargy or loss of appetite. With muscle weakness, keep a watch out for classic signs, including difficulty in walking or neck ventriflexion. These typical signs and symptoms can be spotted during patient assessment in your nurse clinics. Once you suspect that the pet cat has hypokalemia, confirm with blood work, including serum heparin plasma concentration tests. Also, take a full medical history and ensure a full clinical assessment to correlate the blood work with clinical signs and medical history. Generally, hypokalemia can be managed with simple potassium products, but in more severe cases, the cat may require intravenous potassium supplementation. In most general non-severe cases, oral potassium supplements can be used, especially in more mild cases. A potassium-rich diet can also help to manage this condition in the long term. Finally, all interventions should be monitored regularly under the care of the veterinary practice, especially if these involve prescribed medications. During the monitoring phase, it is important to check potassium levels, keeping a vigilant watch out for changes in clinical signs. Ensure that the cat maintains being well hydrated and that the cat also receives potassium-rich diet if recommended. Supporting the pet owner is absolutely key. So as well as caring for the pet, it is often down to you, the veterinary nurses, in educating and supporting our pet owners to effectively manage hypokalemia in their cat's home. The pet owners will need to be educated on the condition of hypokalemia, as well as to receive clear advice on diet and clinical signs. As a practice, you may already have leaflets or access to links to support the education of the pet owner. When looking to prevent the recurrence of hypokalemia in cats, there are a number of key strategies we need to ensure are a continuum, including the ongoing monitoring with regular blood tests, the consistent dietary management with a potassium-rich diet, and ensuring that the cat owners are receiving continuous support through education and feedback. And looking ahead, the outlook should actually be a really positive one. We know that with early intervention and good management, that most cats will recover well. Follow-up is an integral part of the plan, with potassium levels being regularly monitored and treatment adjusted where necessary. In chronic cases, ongoing management may be necessary, but all possible through the pathways we have already addressed. So let's look at a case of a 13-year-old male-neutered domestic short-tailed cat called Leo. Leo has had chronic kidney disease for some time, and he had his last checkup about 4 months ago. Recently, his owner reported that he's become quite unkeen on some of his renal food, and she's been concerned about some of his weight loss. The owner reports appetite for other food is absolutely fine, but he has also been a little bit quiet and not eating as much, not quite himself. During his assessment versus his previous assessment 4 months ago, he had lost quite a lot of weight from 3.5 kg now at 2.7, which actually as a percentage weight loss was classed as extreme, 24%. His blood pressure was fine, but he was reported as being clinically mildly dehydrated. So potassium assessment is important in Leo. Well, we can see here that there is a pre-existing diagnosis of kidney disease, chronic kidney disease, and the fact that he's not currently eating his renal food. Leo has not felt well this week, and also there's a suspicion of dehydration. Following the results of the blood tests, the laboratory results indicate that Leo has high levels of SDMA, creatinine and urea, suggesting kidney dysfunction, which is consistent with the diagnosis of chronic kidney disease. The note also indicates that Leo also has acute chronic kidney disease with dehydration and moderately severe hypokalaemia. So how should we treat Leo? The lab results support the clinical assessment that Leo's chronic kidney disease has progressed. The immediate goals for Leo's treatment will be to address his dehydration and manage and correct the hypokalaemia. This will likely involve fluid therapy, nutritional support, and potassium supplementation. It is advisable to continue to monitor Leo's response to the treatment closely and adjust his plan as needed to ensure the best quality of life for our feline. In managing hypokalaemia, it is crucial to tailor our treatment plan to the specific needs of our patient based on their current serum potassium levels. The chart below shows us exactly what we need to be focusing on for Leo with his particular condition. Managing potassium is a big part of taking care of cats with chronic kidney disease. The experts who study cats' health tell us that keeping an eye on potassium levels is really important. They say that we don't have information on whether managing potassium makes cats live longer, but we do know that it can make their quality of life better, especially if they don't have enough potassium in their blood. The guidelines recommend that we should check the potassium levels regularly in cats with kidney issues. If the levels are too low, we can give them a special kind of potassium to help bring their levels back up to where they should be. This is all about making sure our furry friends feel as good as they can and stay healthy, even with kidney disease. So let's wrap up with the main things to remember about treating low potassium in cats. Firstly, catching the problem early helps a lot. If we keep an eye on our cat's health and spot the signs that something's off, something's wrong, we can do something about it before it gets worse. Next, we've got to tackle the issue from all angles. This means giving cats the right supplements, making sure that their diet is rich in potassium to help level things up, and dealing with other health issues that might be causing the problem. As vet nurses, you've got a big part to play. you're the ones keeping an eye on our feline friends, checking their health and teaching their pet owners what to watch out for. And speaking of humans, pet owners, we need to make sure that they remember that they're part of this team too. It's super important to help pet owners learn about their cat's condition and what they can do at home to help keep them healthy and stop the problem from coming back. Together, we can make cats stay happy and healthy. For further information, we've included as many references that supplement this presentation. And if you want any further information or have any questions, please don't hesitate to contact us at inquiries@samaxia.com.